Hello to all my nurse colleagues in the Turkish Nurses Association. I'm Pam Cipriano, President of the International Council of Nurses, and I'm so pleased to be joining you today. We are so excited to be celebrating International Nurses Day once again, and our theme for 2024 is Our Nurses, Our Future, the Economic Power of Care. This is a very powerful message this year. Not only do we celebrate international nurses each year and do that in order to bring thanks and give recognition to nurses, but this year we are sending a stronger and different message as well. And that is we want to reimagine the value of nursing. We know that nursing are the unsung heroes of healthcare. We know that without nurses, our system cannot function. So, as the cornerstone of strong healthcare systems, we also know that sometimes we need to be able to provide facts and information that really explain why we are so critical to our countries so that they invest in nurses in order to invest in the future of health for their people. Now, hopefully, you will remember that last year, ICN launched the Charter for Change, which has 10 policy recommendations that we would like governments and employers to follow that not only strengthen nursing, but define the political will that is needed to invest, to shore up educational systems, to protect nurses, to create the positions in our workforces that are needed, and to make sure that we are having meaningful engagement of all of our nurses. I'll come back to a few of these in just a little bit. But I want to remind you as well that we have 4 reports that have been guiding our work since the beginning of the pandemic through that recovery. And as we know, so many places around the world are still struggling to retain their workforce and rebuild it. But when we think back to 2020, which was supposed to be the International Year of the Nurse and Midwife, we really stopped short of being able to celebrate because of the COVID-19 pandemic. We are now redoing that report. We're doing the State of the World's Nursing 2, data being collected this year that will be issued next year, so that not only will we be able to build on the information collected in 2020, but we'll be able to see the impact of the pandemic and the current status of where we are with retaining our nursing workforce globally, and what are the steps that we need to take in order to make sure that we are closing the gap where there are shortages. Now, the second report, the Global Strategic Directions for Nursing and Midwifery, is a joint project with the World Health Organization so that we can look together to see what are the steps that must be taken in order to strengthen both nursing and midwifery. And no doubt you've been working on that as well, because we want all of our national nursing associations to help us address strategies for improving jobs, education, leadership, and service delivery, the 4 primary areas of focus in this report. The third report you see, Sustain and Retain in 2022 and beyond, was our first snapshot of looking at what was happening to the workforce in the pandemic. Not only the changes in well-being, but the folks that were leaving the workforce and saying they didn't know how long they could sustain being nurses. Were they going to leave permanently, or did they just need a break? And so we began to really look at the data to be able to say, what do we need to do to make sure we're taking care of our workforce, that we're improving the work environment, not just in the short term when things were very much in crisis mode, but for the future. And so that next report, Recover to Rebuild, was really about making sure that we could re-educate and send the messages about the need to invest in the nursing workforce, because that was the only way we knew we were going to be able to rebuild. So when we come to 2024 and the International Nurses Day, you will be receiving or be able to access our report, which is a very extensive review, not only by nurse experts, but by economists who are able to bring to life the reports, the data, the facts, and the compelling arguments about why we have a case for nursing investment around the world. And so what we know is that it's really important to invest in nurses in order to be able to provide universal health coverage. We need to have that penetration of nurses in every country in order to make that a reality. We also know that we need nurses to work the full scope of their practice. And in many countries, they're restrained. Investing in nursing education is important, not only because it allows us to advance some of the specialization And we know that in Turkey, you have all levels of education through basic and doctorate, but also it is a boost to gender equality and social prosperity. We also know that nurses can help alleviate poverty and be able to promote peace and prosperity, which may not be well known, but is something that we bring out in the report. We also emphasize how important it is to invest in nursing for global economic growth. We know without health, which is what nurses help create, that countries don't have a strong economy. And nurses are a solution that can help transform and strengthen their health services. So what you'll see in the report is that we're focusing on the major global health priorities, and those are universal health coverage, achieving the Sustainable Development Goals, making sure we are improving that access to care, and investing in nursing for the future. It's absolutely clear that investing in safe care, which is where the impact of nurses is so critical, that it saves money. In high-income countries, we've seen that 10%, 1 out of every 10 patients experiences a negative event in their hospital setting. And we know that also costs a tremendous amount of money. With appropriate staffing of registered nurses, we know that we can reduce that significantly. We also know that when we have the right amount of nursing presence, that we are able to have more effective universal health coverage. And so these are just two of the areas that we know are critically important. Now, I mentioned the strategic directions for nursing and midwifery and the 4 areas that we're focusing on. And this is a multi-sectoral problem, if you will, or challenge for all of us. So we know that not only do we, as nursing associations, need to come together with our government and with our other health organizations, but we want to engage the public. And we want to be able to bring other international organizations along, which is why not only is the strategic directions work important, but our Charter for Change and this IND report that says we want to make sure everyone understands the value that nurses bring to strengthening health systems and making a difference in the global economy. Now, one of the barometers that we use is looking at if countries have a UHC score of 80 out of 100, it means that we look at whether or not they have a nursing workforce that can deliver on that. And the goal should be 70 nurses per 10,000 population. So when I looked at the data for Turkey, and you will see Turkey, when we compare you to the European countries, so this is one composite group from the report from WHO, unfortunately, you are at the very, very low end, the lowest of the European group, less than 35 nurses per 10,000. Now, I will mention later on, though, that one of the good things is that your health insurance system has actually provided insurance to 98% of the people that you have, which is a huge part of UHC. But we also never know with some of these metrics, how effective that care is. So I would say that it's important to recognize that one of your jobs is to help influence the need for production of more nurses in Turkey so that you can be sure that you're delivering on all of the goals of universal health coverage. So again, coming back to safety, this is one of the areas that we can always point to in terms of how important the role of the nurse is, not just in hospital care, although the metrics are easier to point out in hospital care, but we know that we need to avoid harm. And so we've participated with the Global Patient Safety Action Plan. And essentially what that says is we must eliminate avoidable harm. We know that we don't want anyone to suffer unnecessarily. And so everyone should have safe and respectful care everywhere. And the secret ingredient for all of that is to make sure that we have enough nurses providing that care. Similarly, ICN has issued a position statement on patient safety, and it's important to recognize that we can't provide safety to our patients unless we're also safe. And so we know that we must have health worker safety. We have to be able to eliminate the violence and abuse. We need to address burnout, and we need to be sure that we are promoting healthy environments that promote physical health as well as mental health for all of our workforce and our nurses, and know that that's really important to delivering high quality patient care. So why does this matter? Again, we are able to look at two sides of the coin of patient safety. Again, patient safety, we want fewer people to have unnecessary deaths. We want to be able to prevent hospital-acquired infections. We want to be able to reduce any morbidities such as falls and failure to rescue, medication errors, and a poor experience. At the same time, we have to take care of our workforce. This is part of that service delivery aspect of our strategic direction. So we want to be able to lower stress levels. We want to be able to make sure that our nurses stay healthy and don't suffer burnout like we know many have right now. We also worked with the Saudi Patient Safety Center to issue a report on nursing staff levels. And this is, again, a worldwide issue. It doesn't matter what country you're in, making sure that we are able to bring that message that safe staffing is cost effective. It saves lives, it saves dollars, it improves the experience of our patients. And really, it's important that we can bring these messages to the leaders of our health systems, to the leaders of our government. Now, I know one of the issues that you raised as important to your discussions this year for International Nurses Day is the substitution for workers that are trying to take the place of nurses. Unfortunately, you are not alone, as countries around the world have suffered with shortages, particularly post-pandemic, even though many of them were there before. There has been this movement to say, well, if it takes 3 or 4 years to create a nurse, educate a nurse, then how can we do that faster and cheaper? Or how can we redeploy other individuals to take the place of that nurse? We know that is not the answer. And one of the things that we've said in this nurse staffing report is, you'll see that first quote, unlike nurses, other healthcare professionals don't have the collective skills that a nurse has because of not only their education, but the observation and close proximity of the patient and the holistic nature of what we do. So we know that others are not able to substitute for nurses. And again, we need to bring these messages forward. So part of our rationale is, again, looking at the evidence that tells us that safe nurse staffing is really critical. And that includes not substituting other less prepared individuals. So we know that safe staffing means that we have the right number of people, not always easy to predict, that in our interdisciplinary care models, that everyone should work to their optimal scope of practice, that we need healthy environments, and we need to be sure that safe staffing is fundamental because it's cost effective and it reduces harm. And we must not substitute for other individuals. So the messages, and I know you already are prepared to say this, cheaper is not better. And it's really all of our jobs to make sure that we're able to communicate that. Now, you may be familiar with an ongoing study that has looked at the outcomes of patient care. These studies started in the United States, but have been brought to Europe in terms of looking at the impact of nurse staffing and also education of nurses in that staffing. These are hospital-centric metrics, but essentially what we've been able to show is that when you don't have enough nurses, you risk an increased mortality of patients. So on average, nurses in medical surgical areas and hospitals are taking care of 4, possibly 5 patients. But if the workload of that nurse is increased by 1 patient, the impact of a patient dying within 30 days of admission increases by 7%. Now, on the flip side of that, the positive is the higher your percentage of university or baccalaureate educated nurses, you can reduce that mortality. So for every 10% increase in BSN educated nurses, you can reduce the potential mortality by 70%. So there are significant evidence-based arguments that you can bring forward to help promote education of more nurses in your university settings and also adequate staffing. So this is part of the RN forecast studies that are going on in Europe right now. Now, we know that there has been underinvestment in nursing, and particularly on the service delivery throughout our organizations. And so once again, we want to be able to use these messages to reimagining and transmitting the value of nursing to say, we must stop underinvestment. Instead, we need to look at how we can increase the direction of funds that are supporting the strengthening of health systems and say we must put those funds into nursing. So that includes everything from full scope of practice to adequate staffing levels, to making sure that the models that fund the positions are there. We can't have countries that are falling for a shortage when in fact they haven't funded the positions that they need to support. And we need to take away practice barriers. So when I mentioned the Charter for Change, there are several principles that I think are important to point out that really, again, underscore our desire to get this commitment in terms of all that we do to invest in nursing. So protect and invest in the nursing profession, the number one item in the Charter for Change. That's pretty self-explanatory. Ensuring safe and healthy working conditions and respect for nurses' rights, a major point of turnaround post-pandemic. We know that nurses will no longer tolerate conditions where they are unsafe, where they don't have their protective equipment, where they don't have adequate numbers of caregivers, where they are put at risk either because of faulty systems or lack of controls to make sure that there's not violence in the work environment. The next one is recruitment and retention of nurses with fair and decent pay, as well as positive practice environments that value nurses' well-being and make sure that their mental health is important. The next we've talked about a little bit, full scope of practice, really important. We don't want to underutilize this really important resource that we have in registered nurses. And then recognizing the value that nurses bring, again, part of our key messages. So you want to know, how can you take action? What can you do? In Turkey, again, I'll give you great kudos. 98.8% of the population is covered by public or private health insurance. That's a goal that all countries should be aiming for in their universal health coverage goals. However, when we look at a few other data points, and these can never be taken in isolation, is that compared to other OECD countries, the total health expenditures in Turkey are below the OECD average. The average per capita expenditure, so how much the country is funding per person, is less than the OECD average. You have fewer doctors practicing per 1,000 population than the OECD average, and similarly, fewer nurses practicing for the OECD population. And you also have a smaller number of beds. Now, one of the other data points I didn't put on the slide, though, is that it does appear that your people are relatively satisfied with your health system. So again, it's finding out then how can you look at some of the outcomes? How can you look at the production of systems that are helping address issues like smoking cessation, where that's a marker. You have your country identifies cancer care as a significant issue. On the other hand, many of the outcomes are very good. So it's important to lift up the covers and look at where you want to be able to lobby your leaders to say, this is why we need more nurses. This is how we will improve the health of citizens in our country. But some of the key areas to think about are part of modernizing nursing laws. Make sure you're looking at how nursing is defined in Turkey. It's very difficult sometimes when you're outside of a country to find that information. So I was not able to determine if you have legal protection for the title nurse, if you have clearly defined what a nurse does in Turkish law. Those would be two really important things to look at, because if you're worried about substitution of others and you have put into the law who can be a nurse, what does their education need to be, and how is their title protected, that is really important to be able to prevent some of this substitution. And then work toward greater autonomy and independence, as well as continuing to strengthen the educational systems. So these are some things that you can do to take action together. All in all, the bottom line messages for all of us this International Nurses Day are to really connect the dots for educating the public, educating our government leaders, educating others who can help us on our journey to reimagine the value of nursing. And so what we want to continue to stress is that nurses are very involved in health promotion. We are pushing more primary care, which is the true path to universal health coverage. Our presence creates better outcomes because of the increase in safety and the holistic care that we provide. We provide inputs to create a stronger economy and health security. This is all about pandemic preparedness as well, and readiness for any health emergencies, as well as making sure that we are saving lives. So the future of the care economy, as has been described by the World Economic Forum, which again is a global force that really speaks to the economists and the governments of the world, is to say we have to really pay attention that the essential skills in the care economy are growing. Nurses are well positioned it is important for us to be recognized that we are the pivotal individuals to help look at economic growth. We know if we don't have healthy people, we don't have a healthy workforce, and we don't have a healthy economy. So we are the solution to that. So I wanted to just end by saying thank you for all that you do. This International Nurses Day is, again, not only a reflection of an opportunity to look to the future, but also to be able to thank everyone for the great work that you do, and also to say this is our time. This is a pivotal moment to be able to reinforce how important it is to send that message that the economic power of care depends on having enough nurses with the right education in the right places. And we want that support now and into the future. So thank you for all you'll do, and best wishes to all. Thank you.